Hello, good morning, or everyone, or good evening to people from India. My name is Shyam Kumar. I'm the CEO of Texila American University. We are here for a presentation to talk about US residency and medical licensing for students. Okay, well, the topic for today is demand for foreign medical doctors in the US. We will talk about how the medical education process works in the US. We'll talk about what are some of the opportunities that are available if you're a foreign medical graduate for you to get into residency programs and practice in the US. And then we'll talk about some of the services that you can avail as a part of this discussion or for you to get into residency programs. That is the core of the discussion. Again, my name is Shyam Kumar. I'm the CEO of Texila American University. We are a medical school based in Guyana in the Caribbean. We ourselves have seen a lot of our own students who come through residency programs from India, from Africa, from different regions. They come through residency programs and get into residency in the US. Other than that, I've been in this industry for almost 20 years. I have worked with students who have gotten into residency programs in the US and supported students in, help them in getting into residency spots, helping them with extensive programs and applications also. So that is our background. That is who we are and what we are. With that said, I think we'll quickly get started with the presentation. Our presentation should run for around 20-25 minutes. And after that, we are open for Q&A. There are three core topics that we will cover today. One is understanding the physician shortage in the US. The second one is how can foreign medical graduates meet this demand? And the third one is process of medical licensing in the US. These are the three key topics that we will cover today. These are the key takeaways for you from today's session. And then towards the end, you can feel free to chime in your questions or thoughts that you might have towards the end of the session. I just included this quote from the AMA president, which resonates with the current physician shortage in the US now. Because it can take up to a decade to properly educate and train a physician, we need to take action now to ensure we have enough physicians to meet the needs of tomorrow. It's a symbol of what we are currently seeing in the US in terms of physician shortages. And let's talk about that a little bit more in detail. Is there a physician shortage in the US currently? At this point, there are around 83 million people in the US live in areas in which access to primary care physician is scarce. Now, primary care physicians, or as we call as PCPs, are your family medicine and internal medicine practitioners whom we would have easy access to for any basic problem. Somebody whom I would say, not feeling well, I have a fever, I have a sore throat, I have a cough. Who do I go to? That's your PCP. There are still a lot of people who does not have easy access to primary care physicians in the US. Now, don't get me wrong. When I say do not have easy access, don't compare our situation in the US here with a underdeveloped country. We're not saying that nobody has access to healthcare here. We're only saying that based on the expectation or based on the requirement that we have projected, there are people who do not have access to primary care physicians based on what we are projecting, what the physician to patient ratio is expected in the US. Now, according to data from the AAMC, the United States could see an estimated shortage of up to 124,000 physicians across all specialties by 2034. Now, AAMC is American Association of Medical Colleges. They are an authenticated body that provides statistical data. And as per them, there is an expected 124,000 physician shortages expected by 2034. Now, it loops back to my previous comment that I read from the AMA president, where he says we have to work now to address the shortage that is expected tomorrow. Diving a little bit more detail into the shortage, detailed breakdown of the projected shortage by specialty area. Primary care is around 17,800 to 48,000 physicians. I already told what is primary care. Non-primary care between 21,000 and 77,100. Surgical specialties 15,800 to 30,000. Medical specialties around 3,800 to 13,400. Other specialties all put together around 10,300 and 35,600. This is what the expected physician shortage broken down by different specialties. So roughly all around there is around 124,000 or 125,000 physician shortage expected in the US in the next around 10 years of time. what is the impact of these shortages? Shortages of this degree present a looming public health crisis. More and more patients will experience delays in accessing medical care, which would have devastating results when it comes to the health of our communities and overall healthcare cost. Now, we have all seen the impact of COVID pandemic in our lives, something that we never expected. So that is probably a result of, everybody was thinking, come on, why US being such a developed country with so many resources have this challenge with patient care during the COVID time. Again, it's all because a result of the physician shortage currently that is being experienced in the US. And again, don't get me wrong, we are not comparing the US shortage with an underdeveloped or developing country. It is purely based on in the US, what are our expectations and where do we stand? According to our expectation, this is how much we should be, and we are currently at 124,000 shortage. And why is there a physician shortage currently? What are the reasons? You can't just expect that one fine day all the physicians decided to retire. And what are some of the factors that are contributing towards physician shortage in the US now? Human life expectancy has increased, which we already know. People are aging more. Life expectancy is much increased, and it's much higher in the US compared to many other countries. So healthcare needs are also increasing. So if the doctor number of physicians does not increase to that proportion, there'll always be a shortage. Many physicians are now nearing the retirement age. There's a huge influx of physicians that came into the system a few years ago or many years ago, and now you are reaching the retirement age at this point. So that is one factor contributing to the physician shortages. The nation's health is also decreasing, which requires additional medical professionals. Approximately 6 in 10 adults live with one or more chronic conditions that must be managed by physicians. Again, this is no secret. In the US, the quality of health is decreasing, and 6 in every 10 adults are to live with chronic health conditions, which has a huge impact on the requirement for physicians. Dr. Ajay Ashwari has raised hand. Dr. Ajay, we will keep the questions for towards the end of the session, please. Okay, we'll take all the questions towards the end of the session. Access to medical schools. Now, that is another important factor. Every year, roughly there are around 50,000 applications that comes into the medical education system in the US, where only 20,000 gets qualified or gets matriculated into medical education program. So lack of medical seats is another reason why there are challenges or creating shortage in the US physician workforces. Okay. Now, what can be done to fix the doctor shortage? One effort that is currently in place is there are influx of alternative medical workforce, which are physician assistants or nursing assistants. Nurse practitioners. Now, what it means is this is not a system that is prevalent in many parts of the world. It's probably unique to the US system alone. There are a secondary level of caregivers who can do a lot of things that the PCP, the primary practitioner or primary care physician can do. They are nurse practitioners and physician assistants, PAs as we call them. They can prescribe, they can see you. So if you go to any of these urgent cares and emergency cares, there are a lot of these nurse practitioners or physician assistants who can, I would say, more or less do a lot of work that a primary care physician or a PCP can do, which takes away a lot of strain from these people, and then it in turn supports a healthcare workforce. Aspiring physicians may also notice an increase in opportunities for debt relief. Student loan forgiveness options are being offered to physicians entering high demand areas of practice, primary care and rural healthcare. Another option is, I'm not sure if many of you know, in the US, most of the students take student loan program or student loans to study medicine. Now, to promote physician workforce in some of these areas where there's a shortage or deficit, the government is giving opportunities of loan forgiveness. If you've taken a loan and if you're willing to, let's say, willing to go and work in this area for 2 years, 3 years, 4 years, we will forgo your loan. Just creating an opportunity for physicians to go and work in certain areas where there's a huge shortage. Because US med schools are having a hard time keeping up with the demand of new doctors, med school hopefuls also have the option to pursue international medical education programs. A lot of medical students are going abroad. Even American students are now going abroad, even to the Caribbean region, to pursue medical education and come back and practice in the US. Now, if students go to a foreign country And from an accredited university, if they get a degree, they have the option to come back and practice medicine in the US. This is about the shortage. We talked about shortages. We talked about the reason for some of the shortages and what are some of the options available currently that are being identified to mitigate some of these challenges. Now let's go to the next key point of our discussion, which is how are foreign medical graduates meeting this demand? Now, this is data on Residency Match 2023. We will talk more in detail about Residency Match. Residency Match, as some of you might already know, is a postgraduate training opportunity available to students in the US. With the system currently in the US, if you're a medical doctor, you have to enter into a postgraduate training program. Only then you can practice as a physician in the US. Even if you're a primary care physician, you have to undergo a family medicine or an internal medicine or other programs of your choice and complete the postgraduate training. Only then you can practice as a physician. So I do my MD degree here. MD degree is for 4 years, which is equivalent to the MBBS degree. I do my MD degree here. And then I will have to get into a postgraduate residency program for 3 years or 4 years, depending on what I choose. Only then I can even practice as a basic practitioner currently in the US. That postgraduate training program is called residency program. And getting into a residency program or getting into a postgraduate training program is called a residency match process. So we have some data here in front of us for what kind of students qualified into the residency programs or residency matches in the US available spots. Out of around total number of 34,000 postgraduate training programs or residency programs available, around 8,000 were filled by foreign medical students, around 3,300 by US students, US citizens who were trained abroad, and around 5,000 by students who are foreign medical graduates from foreign countries. So roughly around around 30% of the physician workforce currently, or students who are getting into residency programs, are from foreign medical graduates. And this is how the current system is mitigating some of these challenges that are presented in the US currently in terms of physician challenges, which is onboard and bring in more foreign medical graduates into the system. I'll just give you a quick walkthrough on how the US residency pathway works or how students get into residency programs. So after high school, this is this is more from a for you as a student from India mostly, how the pathway works for you. 12th grade, you enter into medical college, which is probably an MBBS program, and then after once you've completed an MBBS program, you can get into residency programs. That's how the pathway works. So high school, medical education, then you can apply to residency programs. Now, how can you get into a US residency program? This is what we are going to talk about in this coming slide. So for you to get into a residency program, for you to be able to apply to a residency program, there are a few things that you have to complete as a graduate who have completed a medical education. One is complete USMLE Step 1. USMLE Step 1 is an online exam that can be taken from different parts of the world, including India also, where your core basic science knowledge is tested in a computer-based test. It runs for around 8 hours, and the fees for the exam is $975. So you can go into the ECFG website, create a username and user account, and register for a USMLE examination at a prometric center close to where you live and take up the examination. It tests your knowledge on basic medical sciences, including anatomy, physiology, microbiology, pathology, and so on. That's what USMLE Step 1 is. USMLE Step 2, clinical knowledge, is another exam, 9-hour multiple choice exam, similar to basic science, but it is for the subject areas of clinical sciences, which is mostly your pediatrics, family medicine, internal medicine, surgery, and so on and so on. So Step 1, basic science. Step 2 is clinical science. These are two exams that are required for you to apply for a residency program or for you to enter into a residency program. Now, there's another terminology that you should be aware of, which is called ECFG certification. ECFMG is a body. It's called Education Commission for Foreign Medical Graduates. It's a body that authenticates or certifies foreign medical graduates for qualification in the US. So if I'm a foreign medical graduate, I have to submit my credentials to ECFMG. They will verify my credentials and say, okay, good, you have done your education from a recognized university, accredited university, and you are good to be, you are good to practice in the US, or at least you are good to take up residency program applications or match into residency program. Two of the key conditions for USMLE for ECMLE certifications: USMLE step 1, step 2. Once you clear USMLE step 1, step 2, and then you can apply for ECFME certification and you can qualify for this. So ECFME certification is essentially assessing your readiness for graduates of medical schools. It does not guarantee acceptance into programs, and then required for licensure testing. Okay, which is required for USMLE step 3. Now, there is one last step of USMLE called USMLE step 3. Now, step 3 is the third step, which is not a requirement for getting into residency program. But once you are in a residency program, depending on the requirements of your residency program, you will have to clear USMLE step 2 before you have finished your residency program. So step 3 is not a requirement for ECFP certification. Step 3 is not a requirement for you to get into residency program, but you are required to get into residency. For you to get into residency program, you require only step 1, step 2. But prior to completion of your residency program, you are required to complete USMLE step 3. Moving on. Okay. Back again on requirements for ECFG certification. Online application. Students will have to complete the online application through the ECFG portal. Submit all your medical education credentials, and then exam requirements to USMLE step 1 and USMLE step 2 has to be completed prior to you can join the, or you can certify for ECFG or ECFG certification. ECFG certification is a requirement for you to get into residency programs or start their residency program. So just so you know, ECFG certification is purely credentialing you to be a qualified physician who can practice or who can match into residency program. It only means that, okay, you have your credentials validated, your degree is good, you have cleared USMLE step 1, step 2, which means you have enough knowledge to take up residency program. That's what USMLE, ECFG certification means. Now, the next part is how this residency match process works. We'll quickly talk about it in detail. There are a few terminologies that you'll have to know: RAS, match process, AMA, ECFG, and so on. We'll talk about that a little bit more detail in the next slide. Now, as I told in one of my earlier slides, the process of getting into residency program is called match process or match program. Now, before getting into match, there are a few steps that have to be completed. Now, there are thousands of programs in the US where you can submit the application to. So to make the application process easier, there is an electronic system called ERAS, an Electronic Residency Application Services. Now, you as a student, you have to submit your documents, your credentials. You have to submit letters of recommendation, and there are other documents that you have to complete when you apply for residency program. So if you want to apply for like 30 programs, you don't have to submit the application to all 30 programs. You can put everything in ERAS, and then you can pick the program that you want to submit application. The ERAS system will electronically submit the application to the program just to make your life easy. So ERAS is a system that submits your application to different residency programs that you want to apply to, which you can pick and choose. Now, the body that oversees the entire residency application process is called NRMP, National Residency Match Process. Again, just some keywords that you can keep in mind. So in the month of September, you started the application process. You've done everything else prior to that, finished all your USMLE requirements, have your ECFP certification in hand, or as soon as you have done with your USMLE examinations, even before your ECFP certification, you are eligible to apply. But before you start your residency program, you will have to have your ECFP certification done. So in the month of September, ERAS opens up for applications. You can submit all of the applications to the ERAS portal. Pick the residency program that you want to apply to. Once the residency programs receives your application, they will start inviting you for an interview. And you get invited for an interview. Interview will be at the residency at the residency spot at the hospital where the residency program exists. That is where the interview happens. And after the interview, it's an electronic system where you can, let's say you have done around 5 or 6 interviews. It's an electronic interview where you can rate or rank the programs that you want to apply. So I've done these 5 different programs in my choice. These are 1, 2, 3 options available, or my picks in 1, 2, 3. Similarly, a residency program also rank candidates based on their preference. From a residency program, I have interviewed, let's say, around 25 candidates, and these are my choice in the order of my preference. And the system matches with your preference, residency program preferences. The system matches you to the program and gives you results in the month of March. And that is what the match program is. And essentially, the name talks for itself. It is a match process or the match program by which you are matched to a residency program. And that's how the process works. Now, just a quick recap and further steps on medical licensing in the US for a foreign medical graduate. ECFB certification has to be done, for which you have to complete a USMLE examination. After that, you apply for residency to the residency application process, and then match after the once the application is done, you match into your residency program. There are two kinds of visas that you might be eligible for. Most residency program does a J1 application. There are some programs also which does a H1 application, which are slightly more in detail, maybe a topic that we'll cover in the from some of the upcoming sessions. Post-match, you can obtain a license to practice with a specific state that you are in, and eventually get a board certification to practice in most American states. And now, the last key slide for today is why are we talking about all these things? We are residency in USA. We are a system which makes your life much easy for applying for residency programs. Now, one of the key factors that most of the residency programs consider when they take a student to the program is, do you have any US experience? And that's a key challenge that residency program faces. When many students who come from abroad, they come and try to match into residency programs, they have no exposure to US healthcare system. They don't know the policies, they don't know the processes. There are even challenges in terms of communication. When I say communication, don't get me wrong, we're not talking about English language. It is about the body language. It is about the personal space that we keep with patients. And these are all some challenges that residency programs see when new students, especially foreign students who come into the program. So there is definitely a preference for qualified candidates who have done some experience, who have some experience in a US system or a US healthcare system will have an added advantage. Because keep in mind, when you are in a residency program, you are practicing as a doctor, or you're working as a doctor in the residency program, because it's postgraduate training, as you already know, which means the hospital is relying on you. You are their workforce to treat their patients. So they need to make sure that they get the best candidates and they cannot take a chance. So experience in the US healthcare system, a US hospital will go an extra mile when you submit an application to a residency program. Residency in USA, we place you in extensive programs, which is called extensive programs, is give you exposure to US healthcare system, exposure to a clinical hospital in the US, where you can take up your extensive program and get exposed to a US healthcare system, number one. Now, number two, we place you in hospitals where there are already a residency program existing. Okay, so that is one added advantage. Remember, we talked about the ranking of residency program, where you rank a program, where the program also ranks you. And when the program ranks you in the choice of the preference, imagine a program, you're getting an interview in a program where you have done already your externship. You know the program director, you know the students, you know the residents who are already there. They all have a say in your ranking. If they believe you are a good candidate, you have an added edge. Okay, this guy has been in residency in an externship program with us in the last few months. Good, we are okay in taking him. So your rank goes higher. So if we give you opportunity to do an externship in a program, whether it's an existing residency program, if you are good, your aptitude is good, if you can showcase yourself as a good candidate to that program, you have a good chance of getting into a residency program there itself. Now, second one is we support you with residency application services, which means we help you with your application in the RAS application process. We help you with documentation. We help you with your personal statement or admissions essay. That's a critical requirement when you apply for a residency program. Your essay. What are you going to write about yourself? And that is a story that goes into a residency program on why they should consider you. Exactly what you have written. So we help you, give you feedback on narrating your story properly to residency programs. We also help you with your letters of recommendation. Another critical important factor, which is letter of recommendation. Now keep in mind, in the US, people don't really write letter of recommendation for no reason. So if I'm in a residency program, working in a residency program, if I am referring my student as a good student, other programs will definitely see some value in it. So letters of recommendation has a lot of value, but it is on you. If you're a good student, if you have proven yourself through our extensive program, we can help you in getting a good letter of recommendation. We can in turn work in your favor. Lastly, we also offer USMLE review program for students. We have online, we have partnered with Kaplan Medical, which is the leading USMLE review program in the US. We have partnered with them. They offer online as well as on-campus based US review program. So you can take your USMLE review program online, or you can take it at centers in the US in different locations. So these are the three options that we offer for students while we support them in their residency application process. I think with that said, we have completed our PowerPoint presentation, and I'm open for questions. Dr. Ajay Ashwati, you are an Orland maxillofacial surgeon, and I'm looking for a clinical residency in the US. I mean, what we're talking here is about not about dental programs. We are talking about MD program. The dental program works differently, but if you're a medical doctor, the system works the same. You have to go through the entire residency application process that we just talked about. I've graduated from India in 2014. How does this affect as an old medical graduate? Very good question. See, now, if you have graduated from India in 2014, the question is, what have you done till now? If you have a history of activities that you have done, let's say you have worked in a hospital, if you have worked in a medical school, that's your story. You have practiced in the setting for an extended period of time, which enables you, or now you want to explore better opportunities. There's nothing wrong doing that. But if you have not done anything, or if you have been staying home after being a medical practitioner, that doesn't deny you for application. But again, that is something that they will consider, saying, hey, this student does not seem to be very motivated because he or she has not taken up anything much after her medical graduation. So that's a question that needs to be answered. But it's your history. If you have been working, if you've been training, if you have been doing things in a similar practice, in turn, it will work in your favor that you have taken up clinical practice after this, and now you want to get into a residency program in the US, will work in your favor. Okay. I'm a medical graduate from Philippines, graduated in 2022. I have a tourist visa. Should I go for externship or try to prepare for USMLE step 1? See, I have seen students do both. Okay. If you ask me what is the right thing to do, I would definitely say take up USMLE step 1 and then get into externship program. At the same time, if you're a student with aptitude, I've also seen students who take up the externship program and parallelly work on USMLE. If you want to get into the mode, your externship program generally works half days. So half day you can be the hospital externship programs, and then remaining half day you can take up your USMLE training. One advantage of doing this is you get connected with peer groups. There are other students either doing clinical training or externship in the US. You can connect with them and create some learning plans along with other students. So that's an opportunity. So it is depending on your lifestyle, your choice of what you want to do. But with that said, the sooner the better. A recent experience in clinical experience and a recent USMLE step 1 experience will definitely, USMLE step 1's passing will definitely work in your favor. You're on tourist visa, yes. With a B1 visa, you can do observership or externship in the US. Are there any other questions? How about choosing alternate career pathways in USA? Well, I cannot advise you on that. Alternate career path is not something that I can advise. We can only advise you on residency programs and applications and medical practice in the US within the scope of what we do. Alternate career paths is not something that I can advise. What kind of visa does a residency program offer? Most residency programs offer a J1 visa. I think I covered this in one of the earlier slides. Most residency programs offer J1 visa, but there are also some programs that will offer the H1 visa. Okay, well, assuming there are no other questions, it was nice talking to all of you. Thank you for the time, and we'll be in touch. We do conduct a lot of sessions very frequently. I think we do at least 2 sessions in a month. So please join us. Inform your friends about this session. If we can provide you any information that you don't already have, we'll be grateful. So thank you once again, and thank you for the opportunity. I wish you all the very best and have a good night. Thank you.